all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart.
Good evening. Here we meet again in yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Jessila Mujib. This talk show is purely dedicated to all your health related queries and concerns. Today the topic of discussion is hypertension or high blood pressure, and we have with us Dr. Eldho George from Al Hilal Hospital, Salmabad. He is a specialist in internal medicine with an experience of over 12 years. So, doctor, welcome to the show and thank you for joining us today.
Good evening. Thank you for inviting me to this show, and good evening to all the viewers who are watching this show. Okay.
Good evening, doctor. Yeah. So, doctor, we would like to know what are the causes of hypertension?
Okay. Before going into the causes of hypertension, let me tell you what a normal blood pressure is. So, you have heard of the number 120/80, which is called as a normal blood pressure. So, this 120 is called as a systolic blood pressure and 80 is called as diastolic pressure. As you know, like heart acts as a pump. So, when the heart contracts, it ejects out blood, and that the pressure exerted during contraction is called as systolic blood pressure. That means when the heart contracts, and that pressure is termed as systolic blood pressure, and when the heart relaxes, that pressure is called as diastolic blood pressure. So, you asked me the causes for hypertension. So, hypertension is divided into primary hypertension as well as secondary hypertension. So, what is this primary hypertension? Primary hypertension mainly has a genetic cause or a predisposition, genetic predisposition, because it runs in families. Other factors like smoking, alcohol, excessive intake of salt, sedentary lifestyle, all these can cause an increase in blood pressure. And coming to secondary hypertension. So, secondary hypertension is due to diseases of other organs, say in case of a renal or a kidney related disease like commonly called as renal artery stenosis, means the blood supply or the blood vessel supplying the kidney is narrowed or stenosed, then that can cause an increase in blood pressure. Then thyroid disorders, very well known thyroid disorders can also increase in blood pressure. Then certain conditions like pheochromocytoma, Cushing syndrome, all these can cause an increase in blood pressure, but these are all secondary causes of hypertension. That means you have to treat that cause, then your blood pressure will be normalized or can adequately control the blood pressure. These are the certain causes of hypertension. Then commonly stress, stressful life, all these are some of the causes of hypertension.
So, doctor, what are the symptoms of hypertension? We usually hear that there are no major symptoms.
Actually, what you said is almost right. Hypertension is considered to be a silent killer. That means most of the times it doesn't have so much of symptoms, but there are symptoms like headaches. Most of the people, when they get a headache, they usually think that it can be due to hypertension. So you should be careful also, like if you have recurrent headaches, then giddiness, like you are having some reeling sensation or vertigo like sensation, then you should be you should think of hypertension. Then certain conditions like epistaxis. Epistaxis means bleeding from the nostril. Okay. So that can be a cause for hypertension also. That time you might be knowing that time only when you come for bleeding from, when you treat for bleeding from the nose, then that time you will be able to know, you will be coming to know for the first time that you are having hypertension. Then certain symptoms like weak chest pains, then breathing difficulty, like when you walk up a stair or having breathing difficulty experiencing for the first time, all these can be a cause for hypertension.
Now we would like to know about the major complications associated with hypertension.
Okay, so it can affect almost all the organs, like if you are not adequately controlling your blood pressure, or if you don't know you have blood pressure, or if you are not getting adequately treated, then there is a chance that there can be a bleeding in brain, or it is called hemorrhagic stroke, or there can be a stroke, like it can bleed into your brain. The blood vessels can rupture, bleed into your brain, which is called as hemorrhagic stroke, one of the main known complication of hypertension. Then you can go in for cardiac failure, then myocardial infarction, then renal failure, or renal failure means kidney related diseases or kidney related problems if you are having uncontrolled hypertension. Then also it can affect your eyes, blurring of vision, that means you will be able to visualize properly, and you can go in for blindness also, hypertensive retinopathy. All these can be a major complication of hypertension if left untreated, or if you are not adequately controlled.
So, doctor, in some cases a person may not have hypertension, but when he goes to the hospital and monitors, then he may have hypertension.
Yeah.
So, can you explain it?
Yeah, very well. You told very well, because that is termed as white coat hypertension. So a normal person or a person who enters to a doctor's room, sometimes he might be tensed also. So that time when you check his blood pressure will be on the higher side. And other times when he checks normally outside, he might also say that, he or she might also say that he's a normotensive, that means he doesn't have hypertension. When he comes to the room only he's having hypertension. That's a common thing we doctors experience. That's called as white coat hypertension. In other circumstances he will be normal only.
So now you mentioned already about the stress causing hypertension.
Yeah.
Can you make it a little more clear for us?
Yeah. Stress, we are all going through a stressful life, obviously we know that, but how much you are relaxed, how much you can keep relaxed, that can very well control or reduce your blood pressure. Okay, that means a stress-free life is very good for your controlling your BP, blood pressure. Because that stress itself can cause increase in cardiac output, it can increase your blood pressure. So every time if you are leading a stress-free life, then it's very good that the complications as well as the disease, the hypertension, the blood pressure can be controlled. And also there are other factors like smoking, then sedentary lifestyle, intake of salt, more intake of salt. All these can also cause an increase in blood pressure.
Okay, so you mean stress is a major cause for?
Stress is one of the major cause. You should have a stress-free life. You should have proper sleep, at least 8 hours of sleep. All this can reduce your blood pressure.
That is what I was going to ask you. As hypertension is a lifestyle disease,
yeah,
what are the lifestyle modifications you would suggest to normalize hypertension?
Okay, I would suggest, as I told just before, you should have a stress-free life. You should be, and then proper sleep. Then sedentary lifestyle should be avoided. Exercise should be done at least 5 days or like that. You should exercise in a good way, and then avoid smoking. It should be avoided because smoking surely increases the blood pressure. You should reduce your smoking and you should quit your smoking. Then alcohol also should be reduced, and that can also increase your blood pressure. Then like we are used to eat, you have to reduce your intake of salt also. Okay, salt, actually it said that the normal required salt is 5 gram in a day. So but we usually consume more, like it can go up to 10 gram also, because almost all processed food contain salt as a preservative and all, and there are pickles, nuts, all the salads, even salads they add more salt, so that should be reduced. And in a hypertensive patient, the salt intake should be less than, at least 2 to 2.5 gram in a day.
So doctor, you told about the diet.
Yeah.
Can you suggest a good diet for us to normalize the hypertension?
There is an accepted worldwide diet that is called as DASH diet. The full form is DASH. The full form is Dietary Approach to Stop Hypertension. Okay, dietary approach to stop hypertension. In this diet, in this contains all grains. You should have all bread, rice, all grain. This should be included in your diet, at least 35%. Then including green leafy vegetables like cucumber, then tomato, carrots, these mushrooms and all can be added along with this one, and along with that fruits. You should increase your potassium intake like banana, then apricot. These things and all should be increased. At least banana you should take. Only condition where you should avoid potassium intake or you should reduce your potassium intake is kidney diseases, when your potassium levels are high. In that cases, in certain such cases, your potassium intake should be low. Other than that, you should increase your potassium, magnesium and calcium. Okay, and reduce the salt. In this diet, it is made in such a manner. And you should also nuts like nuts and all should be pumpkin seeds. Then this salt. You should not be almonds. All this should not be salted without salt. Reduce the salt or without salt. That should be the diet. And you should avoid certain dairy products which are having so much of fat. Which are more having more fat content.
Salt, like cheese
and all should be avoided, like saturated fats and all. Then you can add fish, meat and all, but avoid red meat. And even the lean meat you are using, that should be, you can grill, steam and boil, but avoid fried. Both in even vegetables also, fried items should be avoided.
So doctor, once a person is diagnosed with high blood pressure, what are the treatment options?
Yeah, treatment or the management options. Management, I have told that the dietary modifications, which includes this one and all, and salt intake should be restricted. Then even excessive sugar also you can reduce. Okay, carbohydrates you should reduce. Then the management and then the treatment aspect. I mean, with the drugs, there are so many classes of antihypertensives available. Antihypertensives means that can reduce the blood pressure. So once you are diagnosed with blood pressure, it's better to start medicines, because as I have mentioned already, that it's a silent killer. So there are different classes like calcium channel blockers, beta blockers, then ARBs, AC inhibitors, diuretics, all these, there are different classes. So they can be given, I mean, they can be combined or can be separately given also, depending on the condition, depending on the control we are getting with these medicines. And next question, I think, will be the side effects.
Yes, side effects of medicines.
Okay. Most commonly it's asked from like a common man or any person can ask like this doubt. Compared to your hypertension and the complications that can have, the side effects are minimal. There are only minimal side effects that are almost negligible also. So the side effects are less, and don't hesitate to take medicines considering that the side effects are more. The side effects are only minimal.
So doctor, once we start the medication, is it lifelong, or can we reduce the dosage according to the normalization of high blood pressure?
Yeah, once you start the medicine, it should be lifelong, because we can adjust the doses depending upon the condition of the patient. We can increase the dose, or we can combine other classes of drugs, but in a normal way it is lifelong only.
Okay. Doctor, any advice from your side for our viewers on a healthy lifestyle?
Yeah, you should maintain a healthy lifestyle. You should have a proper sleep, at least 8 hours of sleep. Then avoid stress-free life. If you are not able to control, approach some doctors or who are able to listen to you. So stress-free life should be there. And then engage in activities where your stressful conditions can be reduced. Then exercise. Then sedentary lifestyle should be avoided. Then salt intake should be minimized. Then that's all regarding the hypertension I'm telling. Then smoking. Avoid smoking. It should be avoided. It should be quitted. Then alcohol. Then the diet. This DASH diet you can try, because it contains everything, but in a good proportionate manner everything is there. Not that even vegetarians can also try without, then means it's a mixed diet, so there is no problem as such. It's accepted to be one of the good diets.
Okay. And doctor, what type of exercise you prefer for hypertension?
And yeah, one more thing, don't be reluctant to take medicine. That's my main advice, because the complications are that severe. So once you are not getting adequately controlled, and if you are not taking medicine, the complication surely will come. So it should be started, and once you are diagnosed to have hypertension, the drugs should be started.
And about the exercise, what type of exercise you prefer for controlling hypertension?
Yeah, you can go for jogging, breathing exercises. Then you can reduce your weight. At least 10% of your weight you should reduce if you are an obese. At least that it can reduce your BP. At least 1 millimeter of BP it can reduce, and the risk also will be reduced.
So obesity is one of the reasons for hypertension?
Yeah, obesity is also one of the reasons for hypertension. That is obesity, obviously sedentary lifestyle, obese and all.
So thank you, doctor. Thank you for joining us and giving us a lot of valuable information about hypertension.
Okay.
Thank
Thank
you
you so much. Thank you for inviting me also. Once again, I thank everyone for watching this video.
So viewers, I hope this was an informative episode. Our health is our most valued possession. So take care of your health. Till we meet again in yet another episode, this is Jesila Mujib signing off. Good night.